14 signs that you may have cancer. Pay attention. Did you know that early detection of cancer can save lives and drastically reduce treatment costs? Imagine discovering that a simple visit to the doctor can make all the difference between an effective intervention and a more invasive treatment. Want to know what the most important signs are that you shouldn't ignore? In today's video, we're going to delve deeply into the importance of early cancer detection and how it can transform the lives of many people. Are you ready to learn how to identify the signs that can save your life? Stay with us until the end because sign number 13 many people have and few can identify. Let's get started. Importance of early cancer detection. Early cancer detection is crucial for increasing the chances of successful treatment and improving patients' quality of life. Identifying cancer in its early stages can allow for less aggressive and more effective interventions, resulting in lower mortality rates. Studies show that many types of cancer are more treatable when diagnosed early, before they spread to other parts of the body. Awareness of the signs and symptoms of cancer is essential to encourage people to seek medical advice quickly. Additionally, early detection can reduce treatment costs, as early stages generally require fewer resources and less complex interventions. Screening programs and educational campaigns play an important role in raising public awareness about the need for regular exams and self-examinations. By promoting a culture of vigilance and self-care, we can help save lives and ease the burden on healthcare systems. Therefore, it is vital for individuals to be aware of warning signs and adopt a proactive attitude toward their health, seeking medical advice at the slightest sign of abnormality. Sign 1. Unexplained weight loss. Unexplained weight loss is a sign that should not be ignored. If you've lost more than 5 kilograms without trying, it could indicate something more serious, including cancer. Several types of cancer, such as stomach, pancreatic, and lung cancer, can cause significant weight loss. This weight loss occurs because cancer can alter the body's metabolism, increasing energy consumption. Additionally, some cancers can produce substances that affect appetite and digestion. If you notice rapid and unexplained weight loss, it is essential to talk to your doctor to investigate the underlying cause. Unexplained weight loss can be one of the first signs of cancer, and early detection can make a significant difference in treatment success. Keeping a record of your weight and paying attention to unintentional changes can help in the early identification of health problems. Therefore, if you're losing weight for no apparent reason, don't hesitate to seek medical advice. Paying attention to this sign can save lives by allowing for early diagnosis and more effective treatment. Sign 2. Frequent fevers. Frequent fevers are a sign that could indicate the presence of cancer. While often associated with infections, recurrent fevers without an apparent cause can be a symptom of cancer, especially if accompanied by other signs such as weight loss or extreme fatigue. Cancer can affect the immune system, making the body more susceptible to infections and causing fevers. Additionally, some types of cancer, such as leukemia and lymphoma, can cause persistent fevers due to abnormal blood cell production. If you have frequent fevers without a clear cause, it is essential to consult a doctor for a thorough evaluation. Keeping a record of the frequency and duration of fevers can help healthcare professionals identify patterns and determine the underlying cause. Early detection of cancer can be facilitated by paying attention to symptoms like frequent fevers, allowing for quicker diagnosis and effective treatment. Therefore, do not ignore recurrent fevers, especially if they persist for more than a few days or are associated with other worrying symptoms. Vigilance and timely medical consultation are crucial for health and well-being. Sign 3. Persistent cough. A persistent cough can be a sign of lung cancer, especially if it lasts more than 3 weeks or is accompanied by blood. While coughing is a common symptom of colds and flu, a cough that does not go away should be a cause for concern. Lung cancer can cause irritation in the airways, resulting in a continuous cough. Additionally, the cough may be dry or productive, with mucus. In some cases, the presence of blood in the sputum is a significant warning sign. If you notice changes in your coughing pattern, it is crucial to consult a doctor for a detailed evaluation. Early detection of lung cancer can significantly improve the chances of successful treatment. Diagnosis may include imaging tests, such as X-rays or CT scans, and, if necessary, a biopsy. Therefore, paying attention to a persistent cough and seeking medical advice can be vital for early identification and treatment of lung cancer. Do not ignore this symptom, especially if accompanied by other signs, such as unexplained weight loss or chest pain. Sign 4. Skin changes. Skin changes, such as spots that change color, size, or texture, can be signs of skin cancer. It is essential to be aware of new spots or changes in existing marks. Melanoma, an aggressive type of skin cancer, often starts as a spot or mole that changes in appearance. Other types of skin cancer, such as basal cell carcinoma and squamous cell carcinoma, can also manifest as skin lesions that do not heal or bleed easily. Regular self-examinations of the skin can help in the early detection of these changes. Pay special attention to areas exposed to the sun, such as the face, neck, and arms. If you notice any suspicious changes, seek a dermatologist for a professional evaluation. Biopsy of a suspicious lesion can confirm the presence of cancer and determine the type and aggressiveness of the disease. Early detection of skin cancer is crucial for effective treatment and can prevent cancer from spreading to other parts of the body. Therefore, do not ignore changes in your skin and seek medical advice at the slightest sign of abnormality. Sign 5. Sores that do not heal. Sores that do not heal within 3 weeks or more can be a warning sign for cancer. These sores can appear anywhere on the body, but are more concerning when they occur in areas exposed to the sun, such as the face, neck, and hands. Skin cancer is a common cause of persistent sores, especially basal cell carcinoma and squamous cell carcinoma. These sores may seem small, but if they do not heal, they should be evaluated by a healthcare professional. In addition to skin cancer, sores in the mouth that do not heal can indicate oral cancer. If you notice a sore that persists for more than a few weeks, especially if it is increasing in size or causing pain, it is important to seek a doctor. Early diagnosis may include a biopsy of the affected area to determine the presence of cancer cells. Early treatments can prevent the disease from progressing and significantly improve outcomes. Therefore, pay attention to sores that do not heal and do not hesitate to seek medical advice for a complete evaluation. Sign 6. Unexpected bleeding. Unexpected bleeding, whether from the nose, mouth, or other parts of the body, can be a sign of cancer. This symptom can occur in various types of cancer, such as bladder, bowel, lung, and uterine cancer. Bleeding can be an indicator that cancer is affecting nearby tissues or that there is an ulceration or abnormal growth. For example, vaginal bleeding outside the menstrual period can indicate cervical or endometrial cancer. Blood in the urine can be a sign of bladder or kidney cancer, while blood in the stool can indicate colorectal cancer. If you experience any type of unexpected bleeding, it is crucial to consult a doctor for a detailed evaluation. Blood tests, imaging tests, and biopsies may be necessary to determine the cause of the bleeding. Early detection is vital for effective treatment and can prevent serious complications. Therefore, do not ignore unexpected bleeding and seek immediate medical advice for a complete evaluation. Paying attention to this sign can save lives by allowing for early diagnosis and more effective treatment. Sign 7. Changes in bowel or urinary habits. Changes in bowel or urinary habits can be important signs of cancer. Constant diarrhea, constipation, or a change in stool consistency may indicate colorectal cancer. Similarly, changes in the frequency, color, or odor of urine can be symptoms of bladder or prostate cancer. These symptoms occur because cancer can interfere with the normal functioning of the digestive or urinary system. Additionally, the presence of blood in the stool or urine is a warning sign that should be investigated immediately. If you notice persistent changes in your bowel or urinary habits, it is crucial to consult a doctor for a thorough evaluation. Exams such as colonoscopy, sigmoidoscopy, and urine tests can help identify the underlying cause of the symptoms. Early detection of colorectal or bladder cancer can significantly improve the chances of successful treatment. Therefore, do not ignore these changes and seek medical advice at the slightest sign of abnormality. Vigilance and timely seeking of medical help are essential for health and well-being. Sign 8. Difficulty swallowing. Difficulty swallowing, also known as dysphagia, can be a symptom of esophageal, stomach, or throat cancer. This symptom occurs when cancer grows and blocks or narrows the esophagus, making it difficult for food to pass. Dysphagia can be accompanied by pain or a sensation that food is stuck in the throat or chest. Additionally, there may be weight loss and malnutrition due to the difficulty in consuming enough food. If you experience persistent difficulty swallowing, it is crucial to consult a doctor for a thorough evaluation. Imaging tests, such as endoscopy or esophagogram, can help identify the cause of dysphagia. Early diagnosis of esophageal cancer or other related cancers can significantly improve the chances of effective treatment. Therefore, do not ignore difficulty swallowing and seek medical advice at the slightest sign of abnormality. Paying attention to this sign can save lives by allowing for early diagnosis and more effective treatment. Sign 9. Hoarseness or voice change. Persistent hoarseness or voice change can be a sign of laryngeal or throat cancer. This symptom occurs when cancer affects the vocal cords or the area around them. Hoarseness can be accompanied by pain when speaking, difficulty breathing, or a sensation of a lump in the throat. While hoarseness can be caused by infections or other benign conditions, a persistent voice change that lasts more than 2 weeks should be evaluated by an otolaryngologist. Early diagnosis of laryngeal cancer may include imaging tests, laryngoscopy, or biopsy. Early detection is crucial for effective treatment and can prevent serious complications. Therefore, if you notice a persistent change in your voice, do not hesitate to seek medical advice. Paying attention to this sign can save lives by allowing for early diagnosis and more effective treatment. Sign 10. Swelling or lumps. Abnormal swelling or lumps in the body, especially in the neck, armpits, or groin, can be signs of cancer. These nodules may be painless and grow gradually. Breast cancer, lymphoma, and thyroid cancer are examples of diseases that can manifest as lumps or swellings. Regular palpation of areas prone to nodules can help in early detection. If you notice a persistent lump or swelling, it is crucial to consult a doctor for a detailed evaluation. Imaging tests, such as ultrasound, mammography, or tomography, and biopsies may be necessary to determine the nature of the swelling. Early detection of cancerous nodules can significantly improve the chances of successful treatment. Therefore, do not ignore swelling or lumps and seek medical advice at the slightest sign of abnormality. Paying attention to this sign can save lives by allowing for early diagnosis and more effective treatment. Sign 11. Indigestion or abdominal discomfort. Persistent indigestion or abdominal discomfort can be a sign of cancer in the digestive system, such as stomach, pancreatic, or bowel cancer. These symptoms may include a feeling of fullness, abdominal pain, nausea, and vomiting. While indigestion can be caused by benign conditions, such as acid reflux, persistent abdominal discomfort that does not respond to common treatments should be investigated. If you experience these symptoms, it is crucial to consult a doctor for a thorough evaluation. Tests such as endoscopy, computed tomography, or ultrasound can help identify the underlying cause of the symptoms. Early detection of cancer in the digestive system can significantly improve the chances of successful treatment. Therefore, do not ignore persistent indigestion or abdominal discomfort and seek medical advice at the slightest sign of abnormality. Paying attention to this sign can save lives by allowing for early diagnosis and more effective treatment. Sign 12. Breast changes. Breast changes, such as swelling, pain, or skin changes, can be signs of breast cancer. It is essential to be aware of new lumps, thickening, or redness in the skin of the breasts. Breast cancer can manifest in various ways, and early detection is crucial for effective treatment. Regular self-examinations and mammograms, as recommended by your doctor, can help identify abnormalities early. If you notice any suspicious changes in your breasts, seek a healthcare professional for a detailed evaluation. Biopsy of a suspicious area can confirm the presence of cancer and determine the type and aggressiveness of the disease. Early detection of breast cancer is vital for treatment success and can prevent cancer from spreading to other parts of the body. Therefore, do not ignore changes in your breasts and seek medical advice at the slightest sign of abnormality. Paying attention to this sign can save lives by allowing for early diagnosis and more effective treatment. Sign 13. Extreme fatigue. Extreme fatigue, without an apparent cause, can be a sign of cancer. This fatigue is different from common tiredness, as it is persistent and does not improve with rest. Cancer can cause extreme fatigue by interfering with the body's metabolism, causing anemia, or releasing substances that affect energy levels. If you are feeling exhausted for no apparent reason, it's time to investigate the cause with a doctor. Blood tests, imaging tests, and other evaluations can help identify the underlying cause of the fatigue. Early detection of cancer can significantly improve the chances of successful treatment. Therefore, do not ignore extreme fatigue and seek medical advice at the slightest sign of abnormality. Paying attention to this sign can save lives by allowing for early diagnosis and more effective treatment. Sign 14. Unexplained pain. Unexplained and persistent pain, without an apparent cause, can be an indicator of cancer. Pain can occur anywhere in the body and may be caused by a tumor pressing on nerves, bones, or other organs. For example, back pain can be a sign of cancer in the bones or internal organs. If you experience constant pain without an apparent reason, it is crucial to seek a doctor for a thorough evaluation. Imaging tests, such as X-rays, CT scans, or MRIs, can help identify the cause of the pain. Early detection of cancer can significantly improve the chances of successful treatment. Therefore, do not ignore unexplained pain and seek medical advice at the slightest sign of abnormality. Paying attention to this sign can save lives by allowing for early diagnosis and more effective treatment. The importance of early detection. Detecting cancer early is fundamental to increasing the chances of successful treatment and improving patients' quality of life. Awareness of the signs and symptoms of cancer is crucial to encourage people to seek medical advice quickly. Early detection can allow for less aggressive and more effective interventions, resulting in lower mortality rates and lower treatment costs. Educational campaigns and screening programs play an important role in raising public awareness about the need for regular exams and self-examinations. By promoting a culture of vigilance and self-care, we can help save lives and ease the burden on healthcare systems. Therefore, it is vital for individuals to be aware of warning signs and adopt a proactive attitude toward their health, seeking medical advice at the slightest sign of abnormality. If you found this video useful, leave your like and share it with friends and family. Write in the comments if you have noticed any of these signs and how your experience was. Don't forget to subscribe to the channel and activate notifications for more videos like this. In the description, you will find links for more information and additional resources. Let's spread the word and save lives together. Active public participation is fundamental to increasing awareness about the importance of early cancer detection. Sharing valuable information can help others recognize warning signs and seek medical advice quickly. Together, we can create a more informed and vigilant community, contributing to everyone's health and well-being.